Hello, my name is Jo Loughlin, and I am the Chief Nursing Officer and Senior Vice President for Hunterdon Healthcare. I started my career at Hunterdon 34 years ago as a licensed practical nurse on one of the original med-surg units known as convalescents. The organization supported me financially and encouraged me to go back to school to obtain my RN at our local community college, Raritan Valley. Early on in my nursing career, the organization identified leadership qualities I didn't even know I had. I transitioned into the evening nursing supervisor, my first formal leadership role, and returned to school once again to obtain my bachelor's degree, where I was supported by the organization every step of the way. It's not easy working full-time and going back to school, but Hunterdon makes it possible. The next transition in my career was being promoted to the nurse manager role on the surgical unit 5 North, again returning to school with full support from the organization and obtaining my master's degree. This role was one of the most rewarding roles as I truly felt that I was the CNO of the unit, and this is the culture at Hunterdon. It gives nurses and leaders the autonomy to lead. Being recognized by senior leadership and other department heads, I was promoted to the Administrative Director of Patient Care Services, overseeing the day-to-day daily nursing operations for the entire hospital, and most recently then received a title change to Assistant Vice President to better reflect responsibilities that I had and to support succession planning for a transition to the Chief Nursing Officer role. I again returned to school, fully supported by the organization, and am proud to say I am on schedule to graduate with my doctorate degree in December. Finally, in May of this year, I was promoted to Chief Nursing Officer and Senior Vice President of Patient Care Services. It's been quite a journey. I am honored, humbled, and proud to lead the best nurses, Hunterdon nurses. They are second to none. Succession planning is something that is critical in healthcare organizations and something historically not done well in nursing, but not at Hunterdon. It's truly important and sets us apart from other hospitals. My story that I shared with you is unique in healthcare organizations, but not unique at Hunterdon. Hunterdon has always has the same benefits that other organizations have. These include competitive salaries, traditional benefits like tuition reimbursement, certification pay, professional achievement levels, and a nurse residency program. But what is different about Hunterdon is the amount of patients our nurses typically have. In the med-surg setting, our ratios are 1 nurse to 4 or 5 patients. In the critical care area, it's 1 nurse to 1 or 2 patients. These ratios allow for nurses to provide the kind of care that they went into nursing to do. Another difference is the career development opportunities. The organization is small enough for anyone interested in expanding their career, but large enough that these opportunities exist. The support that you receive as an employee and as a nurse is done from the beginning during the onboarding experience you receive starting with human resources. It expands to the units or department levels all the way to the executive level. The culture at Hunterdon is unique. It's palpable when you walk through the front door. The caring, friendly, home-like environment makes you feel safe, valued, and appreciated. Relationships are the foundation and cornerstone. We work as a team ensuring that silos don't exist with the patient in the center of all we do. Hunterdon culture is truly what sets us apart. It's kind and caring. The culture gives you confidence and it builds you up. There's respect for one another and everyone treats each other more like a family than coworkers. Every transition I've made at Hunterdon, I was never afraid to not know the answer or ask a question. We all support and help one another. If I had to do it all over again, I would always be a nurse and it would always be at Hunterdon.